Bismillahirrahmanirrahim. My name is Dr. Sayyida Amna Mahmood. Today I have selected the topic about the congenital heart disease of the fetus is Truncus arteriosus. So first we have to brief review of the normal fetal circulation. So as we know, the blood flow through the heart in the fetus is different. The fetal circulation system uses three shunts, which are a small passage that direct blood through needs to be oxygenated. The purpose of this shunt is to bypass certain body parts, in particular the lungs and the liver, that are not fully developed in the fetus and which in the fetus, the baby in the womb. These shunts that bypass the lungs called as a foramen oval. The one shunt is foramen oval, which moves the blood from the right atrium of the heart to the left atrium. Second shunt is ductus arteriosus, which moves the blood from the pulmonary artery to the aorta. The oxygen and the nutrients from the mother bloods are transferred across the placenta. This is the third shunt. Is enrich the blood flow from the umbilical cord to the liver and split into the three branches. The blood then reach the inferior vena cava, a main vein connected to the heart. The most of this blood is sent through the ductus arteriosus, is a shunt that passes highly oxygenated blood through the liver into the inferior vena cava and then into the right atrium of the heart. A small amount of this blood goes directly into the liver to give it the oxygen and nutrients which is needed. The waste product from the fetal bloods are transferred back across the placenta to the mother. So you just see this picture, which is just give us the normal physiology of the heart, that the body is started from the lower side. This is here. You see that this is the right atrium of the heart, and this is the placental form of the vessels is going from the above to the right atrium of the heart, and this is the upper part of the body, and this is the right ventricle, and this is the pulmonary artery. This is the patent ductus arteriosus connected to the pulmonary arteries, and this is aorta, and this is the left atrium of the heart. This is the right atrium of the heart. This is the aorta, the aortic valve, the pulmonary valve. This is the branches of the neck, and this is the left ventricle. Now this picture you can see again. This is the circulation. So you know this is the placenta here, having the umbilical artery and vein. So umbilical vein and the two arteries are connecting from here, from the umbilical, the internal iliac. So they are going from here to the umbilical vein and above the liver here. So there is a ductus venosus which supply the blood direct to the heart and bypass the liver, then is going from inferior vena cava to superior vena cava, the right atrium, the right ventricle, the left atrium, left ventricle, connection of the ductus arteriosus. This is the aorta, neck branches. The opening between the two atrium is a foramen oval, and this is the lungs of the baby lungs. So this is the circulation of the fetus, which is different from the adults. So I already explained this from the, I just read fastly. Inside the fetal heart, the blood enters into the right atrium, the chambers on the right upper side of the heart. When the blood enters into the right atrium, most of it flows through the foramen oval into the left atrium. The blood passes into the left ventricle and then into the aorta. From the aorta, the blood is sent to the heart muscles itself in addition to the brain and the body. After circulation there, the blood returns into the right atrium of the heart through the superior vena cava. The very little of this less oxygenated blood are mixed into the deoxygenated blood and instant going to the back through the foramen oval and goes into the right ventricle. This less oxygenated blood is pumped into the right ventricle and then into the aorta. The small amount of the blood is continued to the lungs, and most of this blood is shunt through the ductus arteriosus into the descending aorta. These blood enter into the umbilical arteries and flow will be completed to connect it again to the placenta as like a filter. The placenta in the placenta, carbon dioxide and the waste products are released to the mother circulation, and the oxygen and nutrients are taken by the mother. At birth, the umbilical cord is clamped and the baby no longer to receive the oxygen from the nutrients and from the mother. So the first breath of the life, the lungs will be around to function it or expand. The lungs expand, the foramen oval, they increase the pressure into the lungs, significant reduction into the pressure of the pulmonary pressure, and then due to the reduction of the pressure, the ductus arteriosus will be closed first, and then this changing of the promoting of the pressure will be closed, and the changes of the pressure of the left atrium of the heart to decrease the pressure of the right atrium. So that shunt is also the foramen oval is closed. What is the, now we are coming back from the truncus arteriosus. So as the name suggests, the trunk is trunk as a one trunk and arteriosus means arteries. So normally we have the main blood vessels leaving from the heart, the one aorta and one is pulmonary artery. But in the truncus arteriosus, when there is a two large arteries carrying the blood away from the heart, does not the two, they have only the one large arteries, and these arteries are called as a truncus seat or truncus arteriosus, and they have the large opening or valves and hole, and they are the pumps both between the both ventricles. They are provided the atrium at once the blood, and there in between the ventricles there is a ventricular septal defect is also. Because of this you have the picture to see here. So this is the main trunk which is have the aorta and the pulmonary artery, and there is a shunt between them because there is a big trunk, big one artery which supply both the aorta and the pulmonary. This is the pulmonary arteries and this is the aorta. So this is because of this the oxygenated and deoxygenated blood will be combined, so body receive the deoxygenated blood as we discuss later. There is some few classifications you have to be just just make it because there is a connection difference as I show in the picture. So this is a connection difference of the different levels of the artery. There is a two classification called Edwards and the Van Paragas classification of truncus arteriosus. Only due to the connection difference they are make some classification, like this is the common one, the main trunk and the aorta and the pulmonary artery have the with BSD, but this is some difference, like the pulmonary is starting from the branching before the aortic valve, some are branching is after the aortic, one is above the artery and one is below, and some are connection with the ductus arteriosus from the ascending aorta. The same, they are also difference, like some are turned from the towards the right side and some are giving the very early branches of the aorta from the neck, and some are the bifurcations of the early or the late pulmonary valves, like that. So this is just classification, but the same is a problem of the main trunk. So the classification associated with problem the right sided aortic arch, interrupt aortic arch, persistent of the primitive aortic arch, DeJour syndrome and Charge syndrome. Now the symptoms is mostly from the truncus arteriosus, the first life of the heart, because this is a cyanotic heart disease. So baby need within the week the first surgery, which is the repairs of this trunk, because baby receiving a mixed blood. So the cyanosis is happened. So this is cyanotic heart disease. So it is blue of the lips and the nail, and the large amount of the blood will be in the lungs. This defect is happening. So reverse of the, because of the not closing of the valves. So the heart, the lungs is developing the pressure, and which is give us the right side failure or congestive heart failure. And the symptom of the congestive heart failure is the same: breath problem, breathing problem, and vomiting. Breastfeeding is impure, poor feeding, blueness of the skin and the nails. Diagnosis by, of course, is a fetal echocardiography in baby in the womb, and when the baby out, just on the fetal echocardiography is done, and the treatment and the feet, if you need it, which is extreme level of the cardiac catheterization, you have to be done. And the treatment, of course, you have to be treated by surgery, and typically repairing of this trunk, and heart and by lungs bypass machine to support the baby. And then you have to be closed this shunt and this ventricular septum defect, and the baby after the repair is 90% are survived. So this is having a good prognosis. Thank you so much.